My name is Ray. I have severe hemophilia B, and I switched to IDELVION in March 2017. Previously, when treating on demand, when I do a look back, I was treating twice a month to treat an active bleed. If something were to happen, I was automatically going and treating immediately to try to prevent as much damage as possible. That was my being aggressive, trying to minimize the damage. Now I'm treating every 14 days to prevent bleeds. So I'm not seeing the joint damage and adding to what already has happened to my body. I worked for Texas Instruments for about 14 years. I started out as a technician there and became a product test engineer. For me, engineering made me very detail-oriented, where you had to document everything that you were doing. And the characteristics that I learned from being an engineer transitioned over into my documenting how I cared for my hemophilia. It allowed me to work with my physicians on tailoring my treatment regimen for me. I've kind of always kept an eye on new products coming into the marketplace for the care of people with hemophilia. And it was through an NHF publication that I first heard about a IDELVION study coming out. When I heard the results and was able to look at it from my engineering background, I actually did a graph of all the data points and saw that I would have good coverage over the 2 weeks. It was very intriguing to me to start this product. The reason I resisted Prophy prior to the longer lasting products was the number of times you'd have to stick yourself. I couldn't really see sticking myself 2 to 3 times a week when I was only having bleeding episodes on average twice a month. Having a product where I could treat every 14 days allowed me not to stick myself any more than I had previously. I'm no longer having any spontaneous bleeds, and it's certainly not adding to the disability that I've had in some of my joints. Certainly a lot of my identity had been wrapped up in being an engineer before I went on disability. I felt a certain loss of identity when that happened. I found advocating for the community was an important part of the role I could play going forward. And that gave me a goal, something to work on. How do we improve the lives of people who come after us? I will advocate a particular position, but I don't judge anybody for choosing the treatment regimen that they're comfortable with. I will tell you how much I feel it's benefited me going on Prophy. With my experience on IDELVION, I would tell people it's never too late to consider Prophy if you're looking to make a change in your treatment.
Important safety information. IDELVION, Coagulation Factor IX Recombinant Albumin Fusion Protein rFIX-FP is used to control and prevent bleeding episodes in children and adults with hemophilia B. Your doctor might also give you IDELVION before surgical procedures. IDELVION can reduce the number of bleeding episodes when used regularly as prophylaxis. IDELVION is administered by intravenous injection into the bloodstream and can be self-administered or administered by a caregiver. Do not inject IDELVION without training and approval from your healthcare provider or hemophilia treatment center. Tell your healthcare provider of any medical condition you might have, including allergies and pregnancy, as well as all medications you are taking. Do not use IDELVION if you know you are allergic to any of its ingredients, including hamster proteins. Tell your doctor if you previously had an allergic reaction to any Factor IX product. Stop treatment and immediately contact your healthcare provider if you see signs of an allergic reaction, including a rash or hives, itching, tightness of chest or throat, difficulty breathing, lightheadedness, dizziness, nausea, or a decrease in blood pressure. Your body can make antibodies, called inhibitors, against Factor IX, which could stop IDELVION from working properly. you might need to be tested for inhibitors from time to time. IDELVION might also increase the risk of abnormal blood clots in your body, especially if you have risk factors. Call your healthcare provider if you have chest pain, difficulty breathing, or leg tenderness or swelling. The most common side effects of IDELVION are headache and dizziness. These are not the only side effects possible. Tell your healthcare provider about any side effect that you experience and contact provider immediately if bleeding does not stop after taking IDELVION. Please see full prescribing information for IDELVION, including patient product information. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. You can also report side effects to CSL Behring's Pharmacovigilance Department at 1-866-915-6958.